fantastic meeting. I would like to welcome Dr. Moza Sharhan, who's the president of the Emirates Medical Association. So in 10 minutes or maybe less, I will just try to go over things that we need to understand about the artificial intelligence. First of all, I'm still a clinician, as Qutayba says. Not a computer person. I'm not a computer guy. Still, I have to look at some of the words when I type, so I still cannot do this. But the point is, it's a new language and it's a new things that we have to understand. So I will go over some concepts with relation to application of the artificial intelligence with asthma. So first of all, now they are redefining who is literate and who is illiterate. So they think anybody who cannot deal or use the computer in a meaningful way is illiterate. So it's no more the one who can write and read. There was a big initiative here to talk about programming. There is the best programmers of the Arab world. It's a big initiative by Sheikh Mohammed for everybody, for young programmers, because they want to encourage people to start programming. And to learn this, you have to know a little bit about how the computer works. Right. So all of us use internet, but you don't need to know how the internet actually works. It works as long as you know how to apply it, as long as you know how to make use of it, to search or to do something. This is what it is. So AI is a smart computers having to deal with so many informations to come up with conclusions that mimic human intelligence when they take decision. And it actually divides into different ways. So one of it is the machine learning, which is you teach the computer how to take decision. The other one is the expert system, which is you use this to make triage on certain decision, like a decision tree. And the other one is the language. So simply when you use your smartphone, when you dictate, so this is, it recognizes your voice and it makes it into text, or the other way around. It can read the text and make it into voice. So that's called language learning. So it divides into three things. So anything that has to do with computer mimicking human decision is called artificial intelligence. If you want to go deeper into this, it will be called machine learning, where now I will tell the computer that the blood pressure is 1, 2, 3, 4, 5, and the computer will tell me this is hypertension, this is hypotension. So this is, the machine is learning. If you want to go deeper into this, it's called deep learning, or DNN, deep neural network. Now the computer will tell you this is hypertension and you have to take that medication or to do 1, 2, 3. So it's steps. The more you dig, the more likely the computer will be smarter in taking decision. So let me go through one of the most important articles that I've seen recently, which is a systemic review of what's been written about asthma and artificial intelligence. And when we train a model, so let's say you want the computer to understand that this is X-ray of a pneumonia. You have to teach the computer that this is how the normal X-ray looks like. And this, you have to give it like 5,000 or 500 normal X-rays to teach the computer that this is how the normal looks like. Then the second thing is to tell them that this is how the abnormal looks like. And then you show them how the pneumonia looks like. And then you validate this. Just to show you how much is this going very fast and catching the fire on terms of the publications. So many people are writing this. So when you look into the application, you have to use buzzwords. These buzzwords you can use, you can write in PubMed or in Google search, you can write asthma / machine learning. You can write asthma / random forest. You can write artificial intelligence. You can write NNN, which is neural network. So all these things are ways of artificial intelligence that it's used with asthma. So the authors have looked into so many articles, and then they reached into 98 articles that talked about artificial intelligence and asthma. They divided it, and I'm going to share this with you, into 48 articles talking about using artificial intelligence in screening, around 31 in classification, then 40 articles about management and monitoring, and then only 1 article about treatment. So there is some space for us here. If anybody who is interested, we can talk about that, and we can do a lot of the work, because this is where we're going now, and I'm going to touch into this. I have 4 minutes. So now, this is the model. So you don't need to understand everything in this table, but we use different methods into defining how to make a decision by a computer. The most advanced one is called DNN, which is Deep Neural Network. And then these are the studies that used ways of diagnosis. So you can use capnography, lung function, clinical notes, and then this is the predictions. And you can see that the ACC means the accuracy, and then sensitivity with specificity. So what they do, they give the computer information about what is asthma, and then they compared it with the physician diagnosis. And then you compare what a human can tell versus what the computer can tell. And you can see that the more you give information, the more likely the accuracy of this model will work like. This is more of the studies that looks into the same thing, and it's the same message. The more you give the computer in terms that this is the spiral of the asthma, this is the history, the more likely the accuracy of this will be fine. Now, they did studies on patient classification. Now you want to teach the computer what Razwana talked about, like who is mild asthma, who is severe. And so I will teach them, if I use Ventolin every day and if I use the steroids, then probably this is severe asthma. So again, there are around 30 articles that it's used, and again showing the accuracy of the computer of telling us this is mild, moderate, severe. Monitoring. During the COVID, we've used a lot of telemedicine. So now with the telemedicine, patient can send us their peak flow, can send us their ACT score test, they can send us their symptoms, and through the monitoring, we can tell whether this is asthma controlled or not controlled. Now, this is an area where we can publish, as I said, because there was only 1 article that talked about, okay, give me proposed treatment for that. Now, we are using artificial intelligence into inhalers, because with smart inhalers, I can tell whether you're compliant or not, whether you're using risky medications or not, and the computer can analyze this to tell you whether you're more likely needing to go to the hospital for the exacerbations. My God, I have 1.5 minutes. So this is using the artificial intelligence in predicting exacerbations. So if the patient is having symptom 1, 2, 3, 4, and the weather is windy, sandstorm like what we had last week, most likely the system will send you alert that most likely you are going to have exacerbation. Now, what do we use to predict asthma? So in this study, they compared clinical notes, patient notes, and parameters like peak flows, spiral. And they use different methods of machine learning. They use something called SMV, DNN, and other ones. Again, you do not need to understand this. All you need to know that the most advanced one is called deep neural network, and that's what we all use now in machine learning. So what they found that the the DNN or deep neural network is the more accurate one because it allows you to give more accurate prediction based on the inputs. All right, so I have talked about using the artificial intelligence with clinical data. Now, there is another major big area of using artificial intelligence, which is using the artificial intelligence into navigating the big data of omics. And in 3 seconds, probably, can I have 1 more minute, please? 2 minutes? Okay, good. So, Prof. Qutaiba knows that we, with his group, working a lot on this now. So it's not enough to know whether this patient is having mild, moderate asthma based on the symptoms or what's the spirometry. No, we are digging deeper now. We are taking saliva and blood, which is something called like liquid biopsy, to understand the omics of the patient, which is the DNA, which is genomics. We study a lot of transcriptomics, which is RNA. And I know that RNA during COVID became very, very famous. And now people are reading it. A lot of the treatment modalities will be using mRNA now. But also we are doing proteomics, which is, so the gene code is genomic, DNA. The message is RNA. And then the messenger is the coding for the proteomic, which will tell you what you have now, whether you have asthma, rheumatoid arthritis, whatever it is. So this is a big data. And a big data has a lot of noise. And the noise, you cannot tell which one to use or not. And for this, you need to use artificial intelligence. So when you use this, so if I go just back to this, this is the trend of the publication of the omics. So at the University of Sharjah, maybe in the last 3 or 4 years, we are only we are only publishing omics because this is the way to go. So when you do this, you will find that probably 50% of what you find is linked. And the other 40 is only noise. You don't need to know anything. And out of this, probably 10%, you will find some pathways, something related to a treatment of the disease that you look at, and in this case will be asthma. So you can combine this with multi-omics, which you add radiomics, which is radiology. You can add biopsies, and then you have something called multi-omics. Now, this is called big data. A human mind cannot make a sense of all this. So you need artificial intelligence, and you need a deep neural network that will use algorithms to tell you, well, this is important, and this is really noise. Again, you have to validate this. So I will just stop here and tell you what I was trying to tell you here is computer programming is something that we need to become at least familiar with the terms. One, machine learning, you do not need to know how it works because there are programmers who will do this, but you should be familiar with the languages and you should be familiar of how to apply it to your disease area. And I hope that I convinced you that even with the asthma, you can use this tool to come up with a better decision. Because I think the talk shouldn't be artificial intelligence of asthma. No, it should be augmented intelligence. And augmented intelligence is using what the computer can tell plus our human ability. Because at the end of the day, no computer can tell you whether the patient is suffering or in pain or not. The computer cannot put a hand and put a nice smile into any patient. So we still need that human touch. And when you use the human capabilities and the human touch with the human emotional intelligence, you put it with what the computer do, then you do the augmented intelligence. And I think this is the way to go. Thank you very much, and I'm already late.
Okay. Bassam, very impressive talk. You know, I really like your talk. And, you know,